Hello, everyone. My name is Solome Tibabu, and I'm the host of the Going Digital Behavioral Health Tech Conference. I'm so thrilled to have Dr. Kate Hobbs Knutson here from Optum Behavioral Care. Welcome, Dr. Hobbs Knutson. How are you?
Great. Thank you for having me. What a great conference. So appreciate the invitation.
Thanks so much. Why don't we start off by, if you could share a little bit about your background and your role?
Sure. By background, I'm an adult and child psychiatrist. I've worked in all kinds of settings, mostly integrated care, emergency department, inpatient, across the full spectrum of mild to severe mental health and substance use disorders. I got in the payer space about 10 years ago, mainly in Medicaid. I worked at the state in Massachusetts and also in North Carolina. And then I started in 2017 at Blue Cross North Carolina and just came over to Optum about 9 months ago. So at Optum, I'm leading, I'm CEO of a company called Optum Behavioral Care. Optum has several sort of sub-companies within it. And it's focused on what it sounds like, really building out and expanding care delivery for mental health and substance use disorders, mainly focused in the outpatient setting. We're focused on improving access and quality, and actually, to the point that we're going to talk about here, measuring outcomes and rewarding those outcomes for providers. So excited to talk more here.
Amazing. And I know you've done a lot of this kind of work at the prior companies you mentioned, so really excited to hear more. So yeah, let's talk more about that. You're literally redesigning behavioral health care delivery, creating scalable models to improve efficiency, quality, access. How exactly are you doing that?
Well, the good news is we have a lot of partners. So there are a lot of really creative, innovative thinkers and providers in this space that we are partnering with. And that's core to the model and core to what we want to build out here. You know, anytime that we're thinking about how to improve behavioral health care delivery, we have to think about the population, right? And so within any population, you've got a full range from mild to severe mental health and substance use. And our ability to identify these sort of conditions earlier, also how we're going to intervene will differ depending on that person falls on the spectrum from mild to severe, also their age and their other circumstances. And one of the challenges in the mental health system today is that, you know, oftentimes people present with, you know, clinical needs, and really they only have access to what's available locally. And as you know, the current system is very fragmented. There are a lot of gaps in the system. And so there's oftentimes a mismatch between what the patient needs and what's available in their local community. And so that's what we really want to address is, you know, through telehealth, through digital means, through a lot of these more innovative methods of delivering care. We want to really build out that full spectrum of mental health and substance use care delivery nationally, so that our members, you know, whatever their clinical need is, it can be met in the community and close to home.
That sounds amazing. And as part of that, I know that integrated care is something you have a lot of experience in. How are you thinking about
that? Yeah, integrated care, first of all, is incredibly important for many reasons. Number one, it improves access, right? If I'm a patient, I've chosen my PCP because I like that person. It's probably close to home or work, and if I can go, you know, to this one place to have all of my health conditions addressed, that's going to be much more convenient for me and also much more acceptable. It also reduces stigma, as you know. And then also potentially improves coordination and safety because people's conditions are being addressed all together and in one setting. So it's a core component of what we're doing here. The other major thing that integrated care solves is the workforce shortages, right? So if we can do a better job of you know, helping to identify and treat mild to moderate conditions within primary care, where it's totally appropriate to treat mild to moderate depression, anxiety within primary care. You know, the bulk of mental health and substance use conditions actually are mild to moderate. So, you know, the National Survey on Drug Use and Health, a lot of these surveys show that, you know, really severe and complex conditions are the minority. The majority are more of these mild to moderate conditions. So again, if you can take those conditions, empower PCPs to address them, Then you've got an opportunity to focus our specialists on that smaller population that has more severe and complex conditions. And so it's a more efficient and a better use of our resources. Also, there's just more primary care providers available, and so it helps us address these workforce shortages that we have. So, core to integrated care is number one, helping primary care practices actually do the work to be able to deliver that model. It is very challenging, right? There's everyone from the office staff to the MA to the nurse, the PCP, everyone is involved in actually delivering this model successfully. And so there's a lot of technical support, a lot of education that goes on really from the beginning all the way throughout delivery of this model that's incredibly important. Another important component is the payment model. So we have collaborative care codes that are really important to reimburse. The other thing, though, where still those collaborative care codes are basically fee-for-service codes. Where we really want to go is toward a model where primary care providers are at global risk for our population for both physical and behavioral health services, and we're putting in the right outcome measures to incentivize them to focus on behavioral health and invest in behavioral health. And then it's really that improving access and also that financial ROI and the health ROI that helps sustain this model over time. So that's ultimately the payment model that we want to get to. But the collaborative care codes absolutely are an important first step.
Wow, this is really innovative and different from how we've done behavioral health before. But maybe we could talk a little bit about measurement and measuring all of this exciting change. In the session prior to this, I talked to some folks on the Optum behavioral health side about measurement-based care. Can you talk about how that applies in your team's work?
Sure. So we're focused on building out behavioral health care delivery, mainly in the outpatient setting. Every provider that we work with practices measurement-based care. And again, we're pushing as hard as we can to building out the payment models that also reinforce and incentivize the improvement, first of all, the measurement, but second of all, the improvement according to those health measures and those outcomes. And so we did a lot of thinking about this at Blue Cross North Carolina and also in my prior Medicaid work. Today, our main health outcome measures for behavioral health are person-reported health outcomes. So surveys like the PHQ-9 for depression, GAD-7 for anxiety. And taking yet another step back more broadly within medicine, we want to be moving towards true health outcome measures to the fullest extent possible. So away from just process measures, measuring steps in the process of care towards real measures of improvement in symptoms and improvement in function so that people can live their happiest, healthiest life. So today, our way to measure true health outcome measures really are these person-reported health outcomes, the symptom review scales. They are incredibly challenging to implement. So many providers of mental health and substance use treatment don't have electronic health records. We were left out of the HITECH Act and all of those sort of incentive payments to build out those EHRs. And so a lot of providers are small and still even on pen and paper. And so asking them to, collect these outcome measures, these surveys, at scale across their patients, and then actually, aggregate them to be able to report to a payer to participate in a value-based payment model is basically impossible if you don't have a really robust EHR. So of critical importance is giving these providers the actual technical support. And even the EHR, that's something that we did at Blue Cross North Carolina that we can talk about. It was not a full-on EHR, but the IT system to be able to do that is critically important. The other thing that many groups get hung up on is, these outcome measures, they are not perfect, right? And I can talk about sort of where we want to go with outcome measures, and they're also diagnosis specific. And so the way we solve for the diagnosis-specific component at Blue Cross is give providers an array of outcome measure tools that they could use. So give them a depression measure, give them an anxiety measure, a bipolar disorder measure, et cetera. The provider can choose which one is most relevant for their patients. And then what we as the payer are holding them accountable to is at least one baseline and at least one follow-up in the measurement period with a consistent scale. And then we reward improvement according to that scale. So we're agnostic as to which scale you're using, but we know like how do you measure improvement according to these scales? And then that's what's getting rewarded, so that we're not, trying to pigeonhole providers to use only, certain tools, whereas, they may, treat a variety of different patients or be super specialized so that they have the different tools that are available to them.
Super interesting. Thank you so much. And you alluded to technology earlier, and of course, this is a digital behavioral health tech conference. I have to ask, how are you thinking about ways to integrate digital technology within Optum behavioral care service delivery?
A couple of ways. So number one, digital also is a workforce multiplier, right? So if there are ways where people can have all of their needs met through a digital platform, then absolutely we would want to provide that. The other major place I see digital being important is as an adjunct to typical, cognitive behavioral therapy or medication management. So if we could, for example, give patients a digital app to support them in between those visits with their regular provider, that only enhances the treatment and enhances basically the dose of treatment that they're getting, right? Because they have the support in between the visits. Also, you could potentially even reduce some of the face-to-face visits, again, building your workforce to have better capacity to work across populations. So I get really excited about these opportunities. The other thing from outcome measures, and we started on this a second ago, these symptom rating scales, again, are basically surveys. So, and especially imagine, I'm working with an adolescent with depression in my clinic, and I'm asking them to think over the last 2 to 4 weeks, how has your mood been? And most of the time I get, how things have been in the last 2 hours. It's very hard to think over, 2 to 4 weeks, like how you've been feeling. And so I get very excited about these more passive ways, using phones, using wearables that we could be tracking these symptoms. And so, you could be tracking heart rate, other sort of signs of sympathetic nervous system arousal through wearable devices. There's ways to track cognition through how we use our phone, the speed at which we type, the mistakes that we make, ways of measuring valence of emotions and texts. And so if that information was available to me in a format that I could use it at the point of care, that would really be a game changer. Because then I have much more robust information that I could potentially track over time that would help me in my clinical decision making. And so I get very excited about that. I'm ready for it. It's all available. It's all out there. I'm ready for it to make it actually into the clinical workflow.
I'm really excited about all of those tech tools as well. Now, what do you think about some of these other adjunct resources like peer support?
Yeah, I am very excited about peer support, community health workers. So these are people from the community, often with lived experience with the health condition that's being addressed, and they're often much better at connecting with people who have active symptoms of mental health or substance use disorder to help them get in access treatment. Also address a lot of the social drivers that create barriers to accessing healthcare. I also see this workforce as a multiplier of the services that the clinicians can provide. So one of the major challenges when I'm treating patients is, as I'm talking with the patient, as we're developing our treatment plan, I'm noting all of the barriers that patient's gonna encounter as they're trying to fulfill that treatment plan. And if these patients had, a support with them, a peer, a community health worker with them to help them navigate that system, the adherence to treatment and the ability to actually engage in that healthcare would be dramatically different. I also get excited about the digital and the telehealth applications for peers and community health workers. So there are a lot that are out there that I think we can build on, and it really will be a game changer for the health system.
Yes, I agree. There's quite a few of them even here today at the event. So let me ask you this. What is your hope for the future of behavioral health?
My hope for the future, actually, it's very, very heartfelt. And this is what's driven me to be in this field and get involved with payers and policies. I am deeply saddened by the difficulty that people have as when they're struggling with mental health and substance use disorders to access care. And it's tragic that people live with these conditions for years, even decades, suffering, not able to access adequate treatment. The other thing that's incredibly frustrating is effective treatment exists. Like, we have lots of evidence-based therapies that work, and the challenge is actually taking those therapies, using digital means, using telehealth, paying for care differently, so that we actually get those effective treatments to the people who need them. And that divide between what's available or what exists in the field versus what people actually have access to, it's a wide gap that I want to work with everybody here to help us narrow that, so that we actually can start to make a dent in this real epidemic that we have in our society.
Absolutely. I think a lot of the audience would agree with that. And I too am excited to help advance innovation, technology, payment models, whatever it takes to expand access to quality behavioral health care. As always, such a delight to speak with you, Dr. Hobbs Knutson. You have so much expertise in this space, and I'm really happy that you could share it with us today. Thanks so much for your time.
Great. I really appreciate the opportunity, and I'm excited about all the work that you're doing. So keep going.